This study examines what the Supreme Court is going to be doing in June when it rules on President Obama's Affordable Care Act. Specifically, what we've tried to do is look at the impact on insurers, since according to our calculations, they have the most to gain and the most to lose as part of this case. What we did is limited our analysis to three core areas. One is looking at what's at stake with the individual mandate, what's at stake with the Medicaid expansion, and then actually a combination of the two. Since if you actually combine those two together, you're looking at 98% of all the spending in the law is confined to those two proposals. For the individual mandate, which is the provision in the law which requires individuals to purchase health insurance. What we found is over a 8-year budget period, which was 2013 to 2020, that $860 billion in new revenue is really at stake in this case for private insurers. Now, if you break that down a bit, what you'll see is about $560 billion of that is in the form of subsidy payments from the federal government to help offset or defray the cost of premiums for consumers. The remainder of that, about $320 billion, is actually the consumer's share of those costs. Now, while $880 billion is the amount of money that's going to be going to the entire insurance sector, the reality is a lot of that money is passed through the health insurance companies in the form of payments to providers and hospitals and nursing homes and things like that. And that's mostly due to a requirement in the law known as the medical loss ratio, which just has a requirement that for every premium dollar in the law, they're required to spend 80 to 85% of that money on actual health care. The remainder they can actually keep for themselves. So if you factor that into the equation, they're actually keeping about $150 billion of that $880 billion total. With the Medicaid expansion, the law actually includes about $670 billion in new spending over this 8-year budget window. However, what we found is that the insurers portion of that is about $150 billion over that period of time. While there is no medical loss ratio requirement in the law, we did apply one here, and in using that filter, what we found is that the health insurers that would be doing business with Medicaid would actually get about $20 billion of revenue out of that $150 billion. If you combine both these pieces together, both the individual mandate and the Medicaid expansion, you start to get to a very large dollar figure. Now you're looking at over $1 trillion in revenue is really at stake here in this case. If you apply medical loss ratios to that $1 trillion figure, you're looking about $175 billion over 8 years that would be going to the insurers. To better appreciate $1 trillion, which is a number with a lot of zeros associated with it, one way to put that into some perspective is if you look at the performance of the 5 largest publicly traded health insurance companies. These are companies like United Health Group, Cigna, and Aetna. Over the last 12 months, they've generated revenue of approximately $260 billion. This new law would actually would be 4 times that amount over an 8-year period of time. So if these companies are looking at this as a new source of revenue going forward, it's quite a bit of new revenue for them and for any investors interested in those companies. And quite frankly, it's also the money at stake in this case that they could lose if the court rules and strikes down the law in its entirety.